is achieveradio.com. Follow us on Twitter at twitter.com/achieveradio.
Here we go now. Go to the Carolyn. Here we go now. Here we go now. The wellness scene with Dr. D. Here we go now. Here we go now. Go to the Carolyn. The wellness scene with Dr. D.
Welcome, everyone, live with Dr. Carolyn Dean here on achieveradio.com. It's Monday, September 10th, and even though it's the second Monday of the month, technically because of the holiday, it's the first Monday of the month, which means it is Doctor to Doctor tonight with Dr. Carolyn Dean, and we are so very thrilled to have Dr. Stephen Sinatra with us as our guest this evening. And I know I've already heard from hundreds of people today how much they love Dr. Sinatra and how much they're looking forward to hearing the show tonight. If you haven't heard from or of Dr. Sinatra, I think would be rare, I just want to let you know that, of course, Dr. Stephen Sinatra is a visionary pioneer and a leading authority in the field of heart health and wellness. Dr. Sinatra is a board-certified cardiologist, and he is also board-certified in internal medicine, and he has additional certifications in nutrition, bioenergetic, psychotherapy, and anti-aging medicine. So this is one of just a great, well-rounded, holistic, open-minded, willing practitioner of medicine who's been on his own journey in integrating all his great information into his practice and into his approach, which he is here to share with us this evening. And, of course, he opened his own private practice in Manchester, Connecticut in 1977. So he's been at it for a minute. I was still in high school when Dr. Sinatra was starting his private practice. And he is a total advocate for the integrative medicine model, and which is geared toward preventing illness through proactive lifestyle changes. And that includes a healthy diet and includes supplementing with nutraceuticals and also reducing stress and engaging in regular exercises and also making choices that cultivate emotional health. And those themes should all sound so familiar to our regular listeners because that is exactly what Dr. Carolyn Dean is about and always prescribing for people who call, listen to our show, and, of course, our customers who work with us through our product website. So with so much in common, I can only imagine that this is going to be the biggest, most gangbustery show tonight. Dr. Dean, are you there?
I absolutely am here. Thank you very much, Ginny. Great introduction. Are you there, Dr. Sinatra?
I'm here.
Oh, that's great. That's great. I will add to the introduction that how I fell in love with Dr. Sinatra is that as soon as he met me, and I don't know dates, but it's probably about 13, 15 years ago, because I'm a medical doctor and a naturopath, it's Dr. Sinatra that started calling me the doctor of the future.
That's right, you remembered.
Of course I remember.
That's right.
And you expected that the bright minds of the day would realize that we all had to be naturopaths and medical doctors. But so what do you think of that prediction? I don't know that I see enough of those out there. What do you think, Stephen?
You know, I really hoped that would be the case. I even offered scholarships for people at Albany Medical Center to attend Bastille. And because my son Drew's a naturopath. He went to Bastyr, and I was really hoping to create a 6-year program. But you know what happened, Carolyn? You know, the medical school had its own turf. The naturopathic school had its own turf. But when you, in the final analysis, the first 2 years are the same. So I tried to create a 6-year program, and yet, you know, for a combined degree, and then the politics got involved. And, you know, it'll probably take somebody a lot stronger than I am, and you know, to follow me. I mean, maybe I'm the John the Baptist. Maybe somebody's got to follow me that could create the MD, ND degree. But I really tried hard, I have to tell you. I really did try. And by the way, some are doing it. Some are doing it. It's just that I was hoping that, you know, we get 10 students per class that would, you know, wanted to have that combined degree, because there's no doubt about it. My God, if you're an MD, ND, you got so many tools in your chest to really help and fix people. I mean, that's the doctor of the future. There's no question about it. I mean, and by the way, I'm sort of like a wannabe naturopath. You know.
Oh, yes.
I mean,
yes, with all the credentials and all that you've done, of course, you are acting and focusing like a naturopath or someone who's doing natural medicine, because I guess part of my dilemma with advising people to see naturopaths is often they just get into what I call green allopathy, where instead of prescribing drugs, they're prescribing handfuls of supplements instead of looking at, like you do, you look at the psychology and the physiology. So what would you like to start off with? We have a lot of questions in our mailbag for you specifically, but what do you want to get across to my audience?
Oh gosh, there's so many things happening. I mean, heartbreak and heart disease is really big right now, and you know, and women, heart attack is a big issue. Like, you know, women who see other women for their heart problems seem to do better. And you know, I answered this question on my website at heartmdinstitute.com. You know, there was a recent study that came out that if you go to the emergency room with chest pain and you're a woman and you see a woman physician, your chances of survival are better than seeing a male. And I really think women connect on an intuitive basis. I mean, women are powerful, and if women can you know, connect on a right brain level and intuitive level, you know, everything doesn't have to be, you know, garden variety or typical symptoms of a heart attack. But I think women have more intuition than men, and when it comes down to a serious illness, I think women treating other women are the way to go. So I agree. As a psychotherapist, I agree with that finding 100%, and that just came out only about 2 weeks ago. So.
Wow.
I really love that article, and it's on my website because I really believe that if you're a woman and you're in the emergency room with chest pain, I hope you're seen by another woman. That's my feeling.
Wow, that's amazing. So give us right at the top again your website where people can go.
Oh, that's on. Let me see. Oh, that's on drsinatra.com. You know, that little article is on drsinatra.com. You know, you can scroll down and actually, you know what? I did an interview with a board-certified female cardiologist, Mimi Guarnieri. I'm sure you know her. And Carolyn, I would love to have you on my, you know, on my web chat. You know, maybe in the next few months.
Oh, sure.
I'm sort of booked up, but. Hey, listen, the author of the Magnesium Miracle, it doesn't get better than you when it comes to magnesium.
Well,
I mean, you're the queen of magnesium. I might be the king of Coach Q10, but you are definitely the queen of magnesium. So, you know, that would be a good show.
Yeah, I'd love to. I'd love to do that. Yes, I guess when I got into the whole magnesium world, people thought I was specializing, but come to think of it, where magnesium now, I mean, they're talking about it influencing 600, 700, 800 different enzyme systems. It's not 325 anymore. So
oh, dear. I'm glad you enlightened me on that. That's great.
Yeah, we'll have to send you the updated book because I doubled the book and I doubled the number of references. It's really huge, and you know the problem is with something like magnesium, it really is the type of magnesium that people get because so much of it is laxative. So people will take as much as Yeah, the oxide, and that's the one that's most sold. People go for it. It's cheaper. It's in the drugstores. So they take as much as they can stand without getting the laxative effect. And if they do, a lot of people will just drop it and say, I can't tolerate this. Tell me what else to take. So then I find people using dozens of other supplements to kind of get around the magnesium deficiency symptoms. But anyway, when I come on your show, I can talk about that. I mean, my folks know enough about magnesium and the magnesium that I created. But we want to know more about your world, and as you say, you're the king of CoQ10. Now, I often say to people, well, you eat your meat, you get your CoQ10. But tell us more about CoQ10.
Well, I mean, CoQ10. I'm a heart specialist, and CoQ10 is literally inside the mitochondria of your heart cells, and about a third of the weight of the heart, if you weigh the heart out, are really mitochondria. And mitochondria drives the energy machinery in the body. It drives ATP in what we call a preferential direction. And the spark, the spark plug that drives the ATP, or the energy of life, or a chi energy, or a prana, whatever you call it, basically is coenzyme Q10. And I was introduced to this, in 1982. I saw a young woman. She was only 30 years old. She had a baby, and she went into heart failure, this postpartum cardiomyopathy. I've only seen 3 cases in my entire lifetime. And thank God, because frequently it's fatal unless they get a heart transplant. But I'll never forget, she saw 2 cardiologists before me. They both recommended heart transplant, which was the right thing to do, but they couldn't match her, and she was dying. And then she saw me, and she couldn't even sleep through the night. She couldn't even walk across the room. I mean, it was pathetic. And plus, she had a 2-year-old plus a newborn. And I suggested CoQ10 because I just learned about it in 1982. And I only put her on 10 milligrams 3 times a day, Carolyn, and it was amazing. In a week, she says, "Doctor, I can't believe it. I can sleep better." I go, "Really?" So I doubled it. A week later, she came in. She goes, "I can walk to the bathroom in the middle of the night, and I'm not short of breath." I said, "Okay, let's double it again." And then the next week, she said, "This is amazing. I can actually walk around my house, cook dinner, et cetera, et cetera." And she was my, first case where I saw such a difference. And it's been an amazing situation for me. I mean, I have treated thousands of people with conventional cardiology. I mean, I still use pharmaceutical drugs when I have to, but I have treated so many young children waiting for heart transplants who are now very older adults. Like, I have the oldest living singlet outlet ventricle in the world. He's refused heart transplantation 3 times now. He's like 33 years old, and I had him as a 9-year-old, And then I was doing a radio show in Brazil. And this Brazilian guy flew up to Florida. I was in Florida at the time, and he interviewed me because his daughter had tetralogy of Fallot, and which is a very high complex congenital heart problem, and it cost about $700,000 to fix. And then he didn't have the money in Brazil, so his cardiologist read my book, Metabolic Cardiology, and he said to him, "Why don't you try the Sinatra approach, metabolic cardiology, Q10, carnitine, ribose, and magnesium, your nutrient." And basically, he put his young daughter, she was about 2-3 years old, on the supplements. And tetralogy of Fallot, if it's unoperated on, it's lethal. It's no question. I mean, these children don't live to 4 or 5 years old. And she showed me a video of herself at 15 and talking to me. And, it's amazing, Carolyn, but I got to tell you, what I've learned in my lifetime about metabolic cardiology, given Q10, carnitine, ribose, and magnesium, is that, and there was an article back in, about 8 years ago, and another one just in last year in 2017. One was in Science, and the other was actually in Science again. And what it strongly suggests is that the heart can regenerate itself because of our own intrinsic stem cells. We've only learned about the stem cell revolution in the last decade. But basically, if the heart is damaged, and remember from medical school, I mean, I'm probably 20 years older than you, but remember from medical school,
heaven.
they said...
let's just dial that back. I started my practice in 1979, and I was an older student when I went into medicine. So,
oh, okay. Well, forgive me then.
No, right. We're right there in the same. So I went to the same medical school training as you did, where they. Anyway, you go ahead.
Well, basically in medical school, we always learned that the survival of heart failure was less than cancer. In other words, people survive better with cancer than with heart failure. And, since I started using CoQ10 and the Awesome Foursome, I saw people living 5, 10, 15, 20, 30 years, even with severe, heart attacks and heart disease. And what I learned through these journal articles and, writing my own books, et cetera, is that we have our intrinsic stem cells. And we have stem cells that actually are active into our body till about 90 years old. But what we didn't realize until recently, the last decade, is that these stem cells, if you live long enough, like with heart failure, that you can regenerate new heart cells in the body. Just like, we replace blood cells every 120 days and the epithelium in our GI tract every 3 days, or in our mouth or our nasal passages. But we replace heart cells up to 40% over a lifetime. Now think about that. So if I have a major heart attack in somebody in their late 20s or early 30s, and I get them to live 10 or 15 years, they may have regenerated 10 or 15% of their heart. So that is really exciting, and that's what metabolic cardiology for me is all about.
Okay, I've taken notes. I can't listen without my fingers typing. So I have it all down here, what you said. Now let me update you on what I've been doing. In the mitochondria, produces the ATP, just like you said. Did you know that 6 of the 8 steps in the Krebs cycle require magnesium?
Well, I knew it required magnesium. I didn't know it was 6 out of 8, so that's pretty cool.
6 out of 8 steps. So that is awesome. And mitochondria are immensely important. As we know, there's huge journals now of mitochondria. I might bring that up in a second, where they just think it's all about mitochondria. But anyway, so what happened with my trajectory, Stephen, is that when I discovered I had magnesium deficiency, when Random House asked me to write the book on magnesium, I realized that my heart palpitations and leg cramps were magnesium deficiency. And when I tried to supplement myself, I would get the laxative effect with 1 pill of anything.
Right, the oxide, yeah.
Yeah, and even the glycinate, every one of them did that to me. A little bit of but anyway, what I did, because everybody was using my book to promote their magnesiums, I knew all the magnesium manufacturers, so I tried to get them to make non-laxative magnesium. And they thought, no, it's too expensive, requires too much education, etc., of the population, of the consumers. So I finally created one. And what I've been able to witness is if I can get people on 1,200 milligrams of elemental magnesium with no laxative effect, they actually kind of circumvent all the things to do with atrial fibrillation and the blood pressure and all the side effects, or the effects and side effects of magnesium deficiency. And we have the miracles that you're talking about. So we'll definitely have to talk after the show, because I'd like to see what my magnesium will do in your protocol, because it could really put things over the top or make things work faster. And, it's something that I should consider more with our people, because I'm just a provider of dietary supplements. I'm not acting as the people's doctor. But that's why we wanted you on the show, because, what are the next steps? Because I have to say to, maybe 5, and only about 5 7% of our customers, well, you really have to work with a holistic cardiologist for the next steps. But and that's what you've got is the CoQ and the carnitine, the ribose. But anyway, it's a here we are back together again.
Well, we haven't seen each other for, 12, 13 years?
We might have been together at
we were in California?
Baltimore.
Well, that was Baltimore, okay.
Remember Baltimore? We all got an award, everybody that we knew.
That's right, yeah, that's right. I remember that.
Everybody.
Yeah.
And,
that was the last time, yeah. That was the last time.
But, there's so much going on, and I totally agree that even the brain, they know now, the neuroplasticity of the brain, you can stimulate the brain by exercises or lasers or whatever to rejuvenate itself. But even in that world, they're forgetting about the building block of magnesium, because magnesium is the most neuroplastic nutrient ever invented by God. It's amazing.
Well, you're the magnesium miracle. You're it. Let me ask you a question, Carolyn, because I was at a CoQ10 conference in England about 12 years ago, and one of the researchers, Dr. Rosenfeld, he actually was a surgeon, a cardiovascular surgeon. He was using magnesium orotate in his post-pump people. And he said something very, very, intellectually that got to my brain, it got to my core. He said magnesium orotate drives ATP in the right direction, and I'm all about ATP in the heart because that's what CoQ10 is. So I added magnesium orotate to my magnesium taurinate, glycinate, and citrate formula, that's the one I use now. And nobody has. I don't know. Do you use orotate? I've looked at a lot of magnesium formulas, but nobody uses it. Just the Australians.
The Europeans did, and they talk about it in the Krebs cycle, but it never really caught on here. But, what happened in my world is because I was able to create this non-laxative, what it is, it's a stabilized ionic form of magnesium that stands apart from the chloride. So when you've got an ion that stays stable for long enough to be absorbed, you don't even have to have gut digestion. It just goes right in. So I get around all these compounds, and we have to get more absorption studies on these compounds because we don't even know how much is being absorbed. They say 4% for magnesium oxide, but that's just into the bloodstream. We don't know how much is even getting in the cells, although you have to know that any time magnesium is used, any type of magnesium, it always has a positive effect. So even magnesium oxide can affect the brain. And, it's kind of drove me a little bit frustrated when that magnesium threonine came on the market.
Oh, theanine? Yeah, right.
Theanine. And they said, it's the only one that gets in the brain. And that was crap because when I read the study, it was only like 7% more absorbed than the next guy. So there's a lot of magnesium on the market. I finally, in the Magnesium Miracle, the 2017 edition that we'll send you, I ended up saying, look, just use Epsom salts, use the natural calm magnesium citrate because it's so available, in drugstores.
Oh, I like Calm. Calm is nice. I've taken it myself.
Yeah, and the third one is my Remag. So I got out of the whole thing about the dozen or more magnesiums because they all require the body to kind of break them down, metabolize them. And yes, these compounds, they break down into their ions, but then magnesium's so reactive, it just binds right up again. So it is very hard to get a good absorption of it. But anyway,
that's great. So listen, when we talk again, do me one favor, because you know more about magnesium than I do. Give me your opinion on the magnesium orotate. Just do a little research on it, because that's the one I've been using in my cardiac population because of the ATP situation. So I'd like to take your pulse on that one.
Right, and you're getting the results, and that means a lot. I guess what what I did is I just concentrated. I specialized in magnesium and didn't really have to jump into the other ones as much as I thought I would. I mean, you know, we all started with Jeff Bland and all the nutrients that they were researching, you know, 30, 40 years ago. And I just fine-tuned it to my magnesium. But anyway, I think I'm going to turn over to Ginny now so she can pummel you with questions from our audience, okay?
Sure, that's okay. Can I say one thing more about magnesium before we take a question?
Sure.
Yeah. Magnesium was introduced to me when I was a fellow in cardiology. I was only about 31 years old. I had just taken my boards, and, you know, I did a 5-year training program. And I'll never forget this, Carolyn. I was treating an acute MI, you know, heart attack, in a young woman. I think she was in her late 30s. She was very young. And have you ever dealt with the arrhythmia called torsade de pointe, where you have swinging ventricular tachycardia? And she had swinging ventricular tachycardia, and I couldn't control it with lidocaine and IV procaine. It was a disaster. I thought she was going to die. And then I decided to give IV magnesium. And I gave her 2 grams of IV magnesium, and it was like a miracle happened. You know, it was over a couple of hours because we were shocking her. She had sustained VT, and then she came into sinus rhythm. But then a miracle happened, and at an early age, I realized how powerful magnesium was in the treatment of cardiac arrhythmias. It was amazing.
Oh, good for you.
And that was 40 years ago.
Yes.
So that's why I started using magnesium when I was such a young doc.
Wow, good for you. My gosh, yeah. And you probably had that information in your head because they use it in eclampsia.
Eclampsia. Exactly.
Pregnant women who have high blood pressure, seizures, and fluid retention, and what do? They put up an IV drip. And why they don't use it in other people for seizures, high blood pressure, and fluid retention, I have no idea. It's another thing that kind of drives you crazy.
Now, I was the only cardiologist in my institution that was using IV magnesium when a patient came into the emergency room and into the coronary care unit or intensive. I was using IV magnesium all the time. So I'm very, very comfortable with it, you know, very, very comfortable.
Yeah.
And I'm so glad that you wrote the book because you even empowered me even more. And I'm looking forward to that 17th edition. I really am.
Yeah, and you wrote a great blurb on it. We're still using it, 15 years later. Thank you.
Oh, good.
So, Ginny, over to you, my co-host, who I've left in the dust there. Ginny, are you still there?
No, of course, and I'm listening with rapt attention. It's so much fun to listen to you guys. It's like a really good blues band, just riffing off one another and making great music. So it's been awesome. Dr. Sinatra, we have so many listeners who are fans of yours, and they have written a lot of questions in. We're going to keep it to the ones that we think bring out the most common questions, you know, and try not to make them too personal. But one of the first questions that many people asked, that you probably already even know what it is which is better for a heart health supplement, CoQ10 or ubiquinol?
Well, you know, I did my own independent research on ubiquinone and ubiquinol. I actually did it about 7 or 8 years ago, and I should have published the study. I didn't publish it, and I really should have, because when ubiquinol first came out, I actually tried it in some of my patients, and then I did an independent study in like 16 patients, and it was amazing. If you have a high-quality ubiquinone, that's very, very bioavailable and absorbable, I saw no difference as opposed to ubiquinol. However, if the bioavailability of a CoQ10 ubiquinone was poor, then the blood levels of ubiquinol was so much, you know, superior. But when I combined it to, you know, the CoQ10 I was using at Healthy Directions and I did the research on at TISHCON, it was really outstanding. What blew my mind, however, was I had a woman weightlifter from Connecticut, a world-renowned weightlifter, and it was a crossover trial, meaning that we did, you know, 3 weeks of of ubiquinol and then 3 weeks of ubiquinone, and we switched them back and forth. She told me on ubiquinol that she couldn't compete. She was like totally vitally exhausted, and I couldn't figure it out. I said, this shouldn't happen. Then there was a person in the Townsend newsletter, a long-distance runner, who was on ubiquinol, who apparently had worse times on ubiquinol as opposed to ubiquinone. And I called the editor up, and I basically said, I had a weightlifter with a similar situation. And then, I've heard of other people who have had, fatigue, easy fatigability, and I don't know why. But my answer to that question is if you have a high-quality ubiquinone, I would stay with ubiquinone. I mean, that's what I use in my own patients, and I get superior blood levels. If the ubiquinone is of poor quality, well, then I would certainly switch to ubiquinol. Does ubiquinol have an advantage in pediatric situations where you have inborn errors of metabolism? I think ubiquinol does have an advantage, in the young population who don't have the enzymes to help metabolize, CoQ10 in the mitochondrial membrane. So I hope I didn't get that too complex, but I still use a high-quality ubiquinone. It's less expensive, too.
The ubiquinone, that's your CoQ10, correct?
Correct. Yeah, that's what we use, yeah.
Right. So, and the high quality, of course, and then that would be Dr. Sinatra's CoQ10, because that is the problem with 50,000 dietary supplements on the market. I mean, what can you trust?
Oh, I know, it's horrible. And when I first started using CoQ10 over 30 years ago, I used to get blood levels all the time after my first 10 years. In other words, I was using CoQ10 for 10 years, and I got hundreds and hundreds of blood levels. And what I realized is that some people who were taking CoQ10 weren't getting high blood levels, and a couple of clinical studies came out that were doomed to fail from the beginning because they were using inadequate, qualitative formulas of CoQ10. So when I started to test blood levels, I realized that some of these blood levels were insignificant. They didn't even budge the needle. And these were inexpensive ubiquinones that were being, people were charging $19.99 a month for. And when I took some of these capsules and I had them assessed at laboratories, I'll never forget this, Carolyn, a 30-milligram dose of CoQ10 had less than 2 milligrams of bioactive CoQ10 in the capsule. I was shocked. I mean, there's a lot of bad guys in the market out there, in targeted nutritional supplements. And the same thing is true with pharmaceuticals. But, people like ourselves who we base our reputation on targeted nutritional supplements. That's why, when we use them, we have to have an enormous quality assurance program behind us to make sure that people are taking the right stuff.
Exactly.
And I know we both do that.
Oh, yeah. Ginny's in charge of that, and she's just relentless, and it is very important. And then we can just say unequivocally, you take these things and you'll do better. So, yeah, it's very important. Ginny, next question.
Okay. This one is for Dr. Sinatra and Dr. Dean, okay? So you both get a shot at this one. I have a question for the show tonight. I've been keeping my AFib under control using Remag, about 3 teaspoons a day in my sea salted water. However, when I go to sleep at night, my heart starts to flutter. And in the past few days after I eat dinner, which is they're on a ketogenic diet, okay? So they're doing intermittent fasting 20 hours a day, and then 4-hour window is eating, okay? She says that her heart starts to flutter after eating in the evening. She says extra salt can help, but will this problem ever go away? I do not take the prescriptions my doctor gave me as I don't like drugs and would like to heal this naturally. If you could answer this question or touch on the subject, that would be great.
All right, so basically what she's having is intermittent paroxysmal atrial fibrillation that may or may not be related to the ketogenic diet. That's what it sounds like. Now, if she's having episodes of atrial fibrillation at night and she's taking her pulse and it's going, let's say, 120s, 140s, 150s, whatever the heart rate is, what worries me about atrial fibrillation is the incidence of blood clotting. And, I hope she's on at least, an aspirin or nattokinase at the very least. At the very, very least, I mean, because I'm a heart specialist, I've seen many, cerebral vascular accidents or strokes in patients who refuse to take, blood thinners like Coumadin, for example. And getting a stroke is absolutely catastrophic. It really is. So I would say to your listener, if these episodes of atrial fibrillation are short-lived, they only last a few minutes, I can accept that. But if they last for a few hours and they're intermittent and they have longer durations, I would definitely have her see her physician or her cardiologist and either take, a mild drug like perhaps a low-dose beta blocker, for example, something like that where, she won't have side effects, and it may help her stay in regular rhythm. The other thing is we've seen ground, earthing, for example, where you put your bare feet on the ground, help a lot of these people because it takes away a lot of sympathetic activation, the central nervous system, it takes it out, and basically these people do a lot better and have more regular rhythm. The other thing is if you have a cordless phone in the house, get rid of it. Cell phones produce atrial fibrillation. So, as a heart specialist, believe me, I've seen it all. I've seen this all. So I worry about the environment. So I hope I didn't answer your question with too long of answer, but atrial fibrillation can be a disaster in some people.
Right. Yeah, all good. I'll take it from the ketogenic diet aspect. One of the triggers of increased heart rate and heart palpitations can be the ketosis of the ketogenic diet, and I will have to add that to my atrial fibrillation booklet and as one of the many stimulus. So you've got someone who's fasting for 20 hours. You are in ketosis. And then when you shift and start eating, what happens to the ketones? Where do they go? Are they flooding the system, not being metabolized? Are they affecting the heart? I would be doing some experiments to see if less fasting or just going off the keto diet to overcome this fluttering that you're talking about. And yes, I agree with Dr. Sinatra that you can't be in fibrillation without some sort of protection. We never tell people to come off their meds. That's the last thing you're going to do. And if you're just on Remag, just to tell you, Stephen, 3 teaspoons, that's 900 milligrams. We do tell people to put sea salt, an unrefined sea salt, in their water to help with remineralization and hydration. Many people are dehydrated, and that causes symptoms. And I would be asking, are you on the Remite as well, the multiple minerals? Are you on the Realign with the methylated B vitamins and the precursor to glutathione and taurine? So there are things that can be experimented. We tell our people, Stephen, that they're in charge of their health. We'll give directions, but they have the responsibility to look at all these aspects, not to just come to us to tell them what to do. So
yeah, well said, Carolyn.
Mm-hmm.
And I'll tell you, I've had so many patients of mine that want to come off Coumadin because of atrial fibrillation, and I've oh my gosh, when you see a stroke in somebody who says, I don't care, doctor, I'm just going to do it, and it's just devastating. So, this is atrial fibrillation is one condition that I'm very vigilant about. So,
right.
We're on the
now,
same page.
if we had enlightened cardiologists such as yourself, because what I've written in my book, Mag Miracle, is that if you put up an IV magnesium and put people in a hyperbaric oxygen chamber after their stroke, you can get back their function.
Right.
So there are things to do, but you don't want to go there. And besides the fact is, what we're both saying is you can take all these nutrients to support your heart, and also take all the medications that you need, and once your tests show that you're no longer fibrillating and your doctor gives you the all clear, then you wean off your drugs.
Right, exactly.
Right. Uh-huh.
And so you're following up to that question then, doctors, for Natalia, who's saying my husband is taking for high blood pressure, Altace, Crestor, aspirin, all at the cardiologist's recommendation. Are there solutions for him not to take these drugs? It sounds to me like what you're both saying is you've got to do the both and. It's not an either or. You've got to stay with the therapy and you've got to add the nutrients because essentially, even taking drugs is not going to resolve a magnesium deficiency or a nutritional deficiency like would be coming from CoQ10. Is that correct?
Oh yeah.
Right.
I would agree with that as well. And whenever a patient wants to get off a drug, and believe me, I share a patient's pain when they're on drugs. And as a physician, I always try to get my patients off one or two or more drugs. But what the patient needs to do is really clear it with their physician. They got to get their physician's blessing whenever coming off a drug.
Mm-hmm.
That's so important.
Yeah. Yeah, I mean, heaven forbid you go off drugs and then you have an episode and you go into your doctor, and instead of taking care of you in a humanitarian way, they'll start deriding you because you didn't take the drugs. You don't want to be hearing that. And it sounds like a small, quote, problem, but to be attacked by your physician or the hospital because you went off your drugs, you can't sustain that when you're already suffering, whatever it is, a new episode of fib, or heaven forbid a stroke or a mild heart attack. You can play both sides. You don't have to do one or the other. And I know years ago when some doctors and not so many MD doctors, but when they got into holistic health, it was like, you have to get off your drugs, and then you start the natural program. That does not compute. There's no need for that.
Correct. No, I agree. I mean, there's a place for drugs and there's a place for non-pharmaceutical treatments. And I'll tell you one thing about high blood pressure, though. My colleagues, I reviewed the paper. I didn't write the paper, but there's a paper on grounding and earthing, sleeping grounded, where 12 participants were able to reduce either one or two antihypertensive drugs. So grounding is another modality you can do that's safe. But remember, grounding thins the blood as well. So we don't recommend people to ground if they're on Coumadin because you'll get an additive blood thinning effect. I mean, Carolyn, I don't know if you know this about it, but we reported this in the literature. The greatest research I've ever done in my lifetime, ever as a heart specialist, is that when you sleep grounded, when you walk barefoot, on Mother Earth, you're absorbing electrons, and basically you're thinning the blood. And we both know that whether it's a stroke or a heart attack, blood clotting is really a major factor of the 21st century, and it's a lot of it is enhanced by not only the diet, but, cordless phones, cell phones. I mean, the list, electromagnetics, the list goes on and on. So basically, whenever you do ground, you're bringing back, a normal physiological mechanism back to the body that drives the body in the direction of healing. So I just wanted to mention that.
Wonderful.
Yeah.
Right.
And I know our customers and our listeners are so desirous of having specific direction about how to do something. Can you tell us what you're talking about when you're talking about grounding? Because then I'm going to have people asking me, do I need to buy a grounding blanket? Do I need a grounding pad? What are you speaking
Okay, here's the bottom line. Number one, do what we did 50 years ago. Walk with leather shoes. I have leather shoes. I do not walk on sneakers. I don't walk on neoprene, or I walk on grounders, which are basically they're flip-flops with an electrode in it. But just get regular thin leather shoes and walk with either no sock or a thin sock, and you'll be grounded. That's number one. Number two, if you don't want to do that, just walk barefoot in your own backyard or on the street or on on a pavement or at the beach whenever you can. If you live in northern Maine in the middle of winter, you can go in your basement on the ground floor, on the concrete, or put your hands next to the fireplace if it's all stone, or basically run some water through your plumbing and grab the fixtures, and you'll ground yourself. Sometimes just a few seconds or a few minutes of grounding can make all the difference, and that's what we've shown in our research. I sleep grounded, which means you can sleep with a grounded sheet. There's silver chloride electrodes in there, and some of the sheets have silver in. Some of them now are, it's sort of like a neoprene substance, almost like a rubbery substance. But there's been so many upgrades that Clint Ober has done over the years that, sleeping grounded is really a phenomenal thing. So many people have healed themselves from so many different ailments. I'm blown away. But again, you don't ground yourself if you're on Coumadin or some of the other blood thinners. You can ground yourself on aspirin and Plavix. I've had no problems with those too. But Coumadin, absolutely. People have had the pro times soar because, remember, grounding thins the blood. And I got to tell you, Carolyn, the greatest research as a cardiologist I've ever made in my entire lifetime. I sent that research to 7 cardiovascular journals. They all turned it down. It was so shocking to me. It was so shocking to me. And then this guy from Sweden, Ali, he's at the Koblinska Institute. He's laughing and laughing. I go, Ali, what are you laughing about? This is the greatest research I've ever done in my life. I say, it's over 40 years. I've written over 100 papers. He goes, you'll be dead and buried, and then somebody might recommend a Nobel Prize for what you did. It was really cute. But that's why he was laughing.
Right.
You know what I mean? It was really amazing.
Right. Well, I got my first grounding sheets when you wrote the book, so I suppose I'm due for an upgrade, correct?
Sure. I mean, how many times have you watched them? A couple hundred times? They're probably not even working now.
I know. Okay.
No,
okay.
I'm glad you're grounding. But remember, barefoot when you can, and leather shoes. Don't walk on rubber anymore. Just, make the investment.
Yes.
Okay, that's what
great.
I do.
Well, and plus Dr. Dean has the benefit of going to the beach in Maui every day, which is a grounding effort all of its own. So, but one thing.
Hey, by the way, where am I calling? What is this area code? Where are you guys right now?
Well, the radio show, where are we? In some weird Midwestern town. Ginny is, and the warehouse is in North Carolina, and I'm in Maui. And where are you?
Oh, my God, you're in Maui, so it's only 3 o'clock in the afternoon there.
No,
is that right?
It's just coming on to 2 o'clock. Yeah,
2 o'clock. Oh, my goodness.
Yeah.
So it's almost 6 hours away. That's right. I'm on the East Coast. Right. Oh, my gosh, that's amazing.
I
my
know.
goodness.
I know your son was over in Hawaii. You have to come and visit. Okay, over to Ginny. Sorry.
All right, over to Ginny. We'll stop yakking.
That's okay. Well, no, but listen, something just kind of clicked with me, and this is totally speculative, but I'm going to ask you to comment on it anyway, Dr. Sinatra, because you said there's some kind of a silver in the grounding sheets. And I wonder if our Pico Silver product would be a grounding force, Carolyn, to be able to take it internally, because we're talking about the electrical conductivity of the body, right, Dr. Sinatra?
Right, exactly, yeah. So you have a silver, like a silver chloride, like an Argentin silver, something like that you take internally?
Well, yes, it's a silver ion. We call it a pico silver for the size of it, and it's not a colloid. The colloids are compounds, but this is pretty pure. But that's a great question because they talk about silver being the most electroconductive mineral ever. So what do you think of that? Do you think silver internally is a grounder?
Well, I don't know. I mean, it might. I mean, we use silver externally because it conducts, the Earth's energy. So, try it. Try using your oral silver and walk barefoot and see how you feel. I mean, that's the way I would say. I mean, if you have a good feeling and feelings never lie. Remember, I'm a psychotherapist, so I always trust people. I always tell people to trust their feelings. So you never know.
Well, we're having such, out-of-the-box results with our Pico Silver that it is probably working on many different levels. So anyway, the great question, Ginny. Thank you.
Okay. Marcy typed in Dr. Sinatra and wants you to ask you this, and I think this is great because I know that you have, and I thought this was so cool, a vibrational food line. And this gal's typing in Dr. Sinatra and saying, can you tell me whether olive oil or coconut oil contribute to cardiovascular issues? I use a lot of organic coconut oil for cooking, olive oil in salad dressings, and I'm seeing alternative doctors now saying that there are dangers in using both.
You know, I would say this. I use both, and, you know, I write for the American College of Nutrition, and we just had an article. Dr. Houston and I just sent an article in which is published, it's just, I think, January of this year in the American College of Nutrition. I mean, let's take coconut oil. I mean, coconut oil, a lot of the traditional doctors and even some of the alternative ones, they'll throw saturated fats under the bus. And, you know, especially the long-chain fats that are in coconut oil, so coconut does have some shorter-chain fats as well. But I look at it this way. There is nothing worse than sugar. Sugar is the enemy. And basically, I like to see people eat more saturated or more monounsaturated. Certainly omega-3 fats are king. I like squid oil and fish oil. I'm not a big fan of krill oil because, you know, I like more DHA supporting, you know, oils. Krill is great for arthritis, by the way. But again, I'm a heart specialist, so I like more of the DHA. But getting back to olive oil, there's no doubt about it. Olive oil is the secret sauce of the Mediterranean diet. Olive oil does everything right. I mean, it is so incredible. I mean, it raises HDL. It makes small particle LDL fluffier and less inflammatory. It lowers triglycerides. And the study that blew me away, where I started to actually, I started to incorporate olive oil into my food line, and I did this about 5 years ago, because I read this study 7 or 8 years ago, and it literally blew me away. I mean, I've always known that the Okinawa diet and the Mediterranean diets were the healthiest in the world. I mean, the Okinawans live about 2 months more than the average Mediterranean, but, you know, both Okinawans and Mediterraneans live about 8 to 9 years more than the average American. So there's something about their diets that's really cool. The Mediterranean diet, olive oil is a staple, and there's no question, I think it's the secret sauce of longevity. And what I read in this article was amazing, that olive oil changes pro-inflammatory genes. You know, we're all born with, you know, genetic SNPs, and basically, you know, these genetic SNPs are getting more and more popular. There's now over 300 risk factors for the heart, just like Carolyn said, and just, you know, introduced to me and taught me an hour ago about, you know, all these different magnesiums in the inner mitochondrial membrane. I didn't know that. But basically, these olive oils are so incredible at alleviating pro-inflammatory genes. In other words, they can take pro-inflammation and turn it back to an anti-inflammatory state. The problem is that a lot of the olive oils that are coming out of Europe now are cut with canola oil, and I'm not a big fan of canola oil. Canola oil, I believe, is good for machines, but not for people. But basically, 100% extra virgin olive oil is so healthy. It's just amazing. And that's why we sell it on Vervana.com. I mean, Carolyn, this is nuts. I don't even know if you notice about me, but, you know, I've been doing vitamins and minerals for over 3 decades. I mean, the only reason why I set up a food business is because with all the, you know, the GMO modified foods and, you know, all the foods with insecticides and pesticides and you know, my last name's Sinatra, so I made my own pasta sauce in a green facility in Ohio. And our pasta sauce, I tested it for we had I spent $1,700 testing it on hundreds of tests, and it's BPA free and it's insecticide free, pesticide free, mercury free. It passed California Prop 65. You know, so I got to tell you, I'm a big believer in lycopene and pasta sauce. And I got to tell you, you know, I'm talking to 2 women, but I had my daughter-in-law had breast cancer. And, you know, it's amazing. 5 years ago when she developed it, I went to the literature, and I found these articles. Carolyn, it's amazing. But if you eat organic broccoli, which contains sulforaphane, and if you combine it with the lycopene of tomato sauce, the incidence of lycopene and sulforaphane is sort of like a knockout punch for, extra mitosis that we see in carcinogenesis and cancer. So I got to tell you, I'm healing my daughter-in-law. She did have surgery. She did take, the traditional therapy. She had chemo and stuff like that. But, the same thing is true of prostate cancer. And those studies that came out of Harvard showing that lycopene has a profound impact on preventing prostate cancer. And if you look at the prostate and the breast, they're very sort of similar, with estrogen receptor sites and stuff like that. So it makes sense. So I just wanted to throw that in. And Carolyn, you and I are a big believer in healthy vibrational foods. I mean, it's the only way to go, and that's why I'm writing the book Vibrational Medicine, and that's the lecture I'm giving across the country now. How to increase your vibration by, you can do it by grounding, you can do it by healthy eating, targeted nutritional supplements, prayer, all the things that, yoga, Tai Chi, all the things that invigorate ourselves to, make them more active and more energized.
Wonderful,
Well, Dr. Sinatra, we're at the top of the hour, and we're going to have to bring it to a close. But I will say Dr. Dean has a vibrational medicine product of her own called the RNA Reset Drops that are amazing. So you're definitely going to have her on your show so you can catch up with all the good things that she's up to. We're going to let everybody know about Ravana.com in the next hour of the program, and also to turn people onto your product website where they can get the CoQ10 that you recommend. And you've just been such a generous guest this evening. Carolyn, your parting words.
I love you, Dr.
Oh, Carolyn, you're so sweet. Oh, my God, you're giving a cardiologist heart flutters. That's
you are
great.
Awesome,
And listen,
yes.
I want you in my show in the next few months at drsinatra.com. We'll have a lot of fun. I'll have Joanne email you.
Or should I email your daughter? I have...
email March. Yeah, email March and tell her that we did our show, and thanks for, doing Vervana. And my other website is Ageless Pets. I do organic stuff for pets. I'm a big pet lover.
Yes.
Remember, I learned a lot of my CoQ10 from dogs. Dogs taught me so much about CoQ10. It's unbelievable,
Awesome.
So now I'm giving back. So anyway, we'll say goodbye, and I love you guys. Great show.
Thank you so much. Bye-bye.
All right.
Aloha.
Bye-bye now. Aloha. Bye-bye.
Oh, that was great. Okay, so we're going to take a brief break, Bill, at the top of the hour, and we'll roll some music, and Dr. Dean's going to wet her whistle, and we'll be back with the rest of the show. Thanks for tuning, everybody. We'll be right back.
We'll be back with Hour 2 of Live with Dr. Carolyn Dean, along with host Ginny Gunther, after this brief station break. You can also get updates and resources online by visiting drcarolyndean.com. Psychic radio, holistic radio, spiritual radio. This is achieveradio.com. Follow us on Twitter at twitter.com/achieveradio.
You can climb floors and then worlds show up. You can go downstairs and worlds disappear. You can go downstairs on the rooftop and you open the door and take a step and you go, I'm on the rooftop. Wait a minute, I better pay attention. So that becomes a fun thing. So that's why we have to come back and say this, relax and allow, soften it up, get your foot off the gas, don't slam on the brakes, just let it coast where you want it to go. Soften, be easy about all this, and stop making a great big huge thing out of great big nothingnesses, because the nothingnesses are serving you very well. You like this blissful place of not caring, because now you care so much about everything that you've got yourself in a position where you don't really care about anything. Good. It's wonderful. Thank you. We are happily, easily ready for more in your experience.
AchieveRadio.com.
Here we go now.
right, everybody. Welcome back. Hour 2 live with Dr. Carolyn Dean. Woohoo! Victorious lap, Carolyn. We've been gone for so many weeks. It's great to be back, and it was so much fun starting with Dr. Sinatra. What do you think?
Oh, yes. He's such a sweetheart. He's so sincere. He's been at this a long time. He got into the supplement business a long time ago. I remember years ago talking to him about it because companies were after me to sell their supplements, but I was definitely focused on what we ended up doing, food-based, etc. But yeah, and he knows his studies. Bob was just saying Dr. Sinatra reminded him of Dr. Andrew Saul, how these guys they're so sincere, they're up on the literature, they're quoting all kinds of research. It is pretty awesome.
It's very, very, very cool. Very cool. Just a great guy. You can just hear his little heart. Just wonderful. Okay, so we've got so many people typing in and chatting in on different things, and I want to just give you a chance before we get started with questions and stuff. Tell us what you've been up to and what's been going on. I mean, it's true, so much. We've been off the air for almost a month now, I think, right?
I know. Yes, I visited Newfoundland and had an awesome time. Swung back through Toronto and had a sit-down meeting with Dr. Jason Fung, F-U-N-G, another new best friend, and he was just so gracious and so sweet. He's written the obesity code and the diabetes code, and he'll join us in 2 months, in November, as our guest and update us on his work. And then Ginny and Greg just happened to be in Toronto at the same time, and we went up to powwow country up, what do they call it, lake country in Ontario, and had a weekend that I suppose was supposed to be a vacation, but Ginny and I just brainstormed the whole time. And then we went to North Carolina, and we shot a bunch of high-quality videos for our websites and Facebook, etc. So it was a lot of fun. Everything, even though it may seem like work, it's just pure fun, high energy and excitement for what we're doing and what we're able to, expose to our audience and to our customers. We're having a great time, and there's lots of testimonials, there's lots of news, there's a ton of blogs that I put out, but I think I'd rather we answer the chat questions, maybe answer questions that people wanted Dr. Sinatra to answer, but I think we got his protocol. We exposed people to his work so people can follow up there. So what do you say? We do chat and phones? Ginny?
Yes, that sounds good. And, yes, for those who want to talk to Dr. Dean this evening, 602-666-6027 is the phone number. And you've probably been waiting patiently to speak to her, but she's back. 602-666-6027, and then you've got to hit *5 on the keypad to let me know that you have a question or comment. And right now I don't have any raised hands, which means if you want to talk to her, you've got to hit *5. So I know you're there. Otherwise, your phone remains on mute and you won't have an opportunity to ask her any questions. Let me go through a couple of these questions, Carolyn. One of which, how long do you have to be off magnesium before taking the blood test? Request a test is asking people to be off for 1 week.
No, I wouldn't be able to survive with a week off my magnesium. So I just tell people to whatever time they go off, do that consistently with all their blood tests. And I just say, like the 12 hours overnight, maybe you could skip your evening dose, but go in the morning for your test, whatever that is going to be, 12 or 20 hours. But think of just being consistent each time. Okay, so that's that.
Okay, very good. And let's ask also, too, Dr. Dean, I visited my dentist, and we were discussing taking magnesium, and she said that magnesium can discolor the teeth and suggests that I use a straw when I'm drinking when I'm drinking my liquid. Any thoughts on this? Can you advise me?
I have no idea what she's talking about. It just makes no sense to me. We've never heard it. No one's ever complained about it. You don't hold the Remag in your mouth, but if you're diluted Remag, it'll go across your teeth. It's a bizarre comment. I have no idea what they're talking about.
Yeah, I think your dentist is probably not on track with that one, which it's okay. Everyone makes a mistake every once in a while. Now, here comes another comment from one of our customers in San Diego. Hi, Ginny and Dr. Dean. I started taking Remag and Remite. I specifically bought stainless steel measuring spoons to measure these wonderful products. And I threw out my aluminum measuring spoons, but now I'm concerned that the same stainless steel spoons are discoloring and showing brown spots. Should I continue to use them? Am I ingesting metal in these spoons? What do you suggest?
Again, I don't know what that means. I've used some really nice stainless steel spoons for years, and I don't notice the difference. I rinse off my spoons after every use, but I can't imagine that's a problem. Have we in the past asked our chemist about what spoons to use, Ginny?
Well, we haven't asked about the spoons, but we have asked when people want to put their Remag and Remite in stainless steel tumblers. Like, for example, the Hydro Flask is a stainless steel lining. And what the chemist has said is that the magnesium is not a problem because it is not in that electrolyte form, but the Remite is a true electrolyte, and it may react, but it's an insignificant reaction, but it is a true electrolyte. But I would question the quality of the stainless steel before I'd, kind of wonder about Remag and Remite. Susan, if you email me at support, SUPPORT, at rnareset.com, let me know that you were the person who chatted in on the radio show. I will send you a set of RNA Reset measuring spoons for your Remag and Remite, and that will definitely solve the problem.
Good.
Yep, very good. Okay, now let's see what else we have going here. Let's talk a minute about nattokinase, Carolyn, because a lot of people typed in about nattokinase, and we didn't really get to that question.
Right. Now, but he did, Dr. Sinatra did say if people have occasional fibrillation, short-lived, he would just say nattokinase and or aspirin. He did say that. So he's in agreement with it. I'm just typing in nattokinase and Dr. Sinatra. So he's got some YouTubes on it. He talks a lot about it. All I do in the AFib book is say that if people are using it, they have to make the decision to do that. Heaven forbid, yes, if you have AFib and you're not on a blood thinner, you have to take responsibility for that. In the AFib book, CB's story talked about how she was on her blood thinners, for a long, long time while she was building up her body. So you educate yourself, Googling nattokinase and Dr. Stephen Sinatra, and see if you can make sense of what he's saying. Not make sense, but see what you want to do in relation to what he's saying. And like he said, he's a cardiologist. He's going to recommend the blood thinners because he does not want to see anybody having a stroke.
Yeah,
so there.
And very good. And somebody typed in how much nattokinase thins the blood. We wouldn't have any idea. It's not like that. You just can't say, oh, this much is going to do it. You have to, like Carolyn says, read up on it, look at it in relationship to everything else you're doing, because is not magnesium a natural statin as well, Carolyn?
Yes, it's a natural statin. And we'll have to send Dr. Sinatra the book, because exactly as he said, I went into full-on magnesium because I found something that you could use to saturate your whole body. And he's used other magnesiums that aren't as absorbable or absorbed, and had to branch out into other nutrients. And it may be that some of our folks could do better faster adding at least the CoQ10, but you have to get a good quality. You have no idea if it's even working when you take a CoQ10 that you just buy off the shelf. And I don't know if we'll ever get into doing a CoQ10 or not, but I would definitely just go to Dr. Sinatra's CoQ10 if that's of interest to you. But most often we say to people, well, you've been on a handful of supplements, including CoQ10, for a couple of years. You come to us, you have all these symptoms, you take Remag, Remite, and Realign for a couple of months, and all your symptoms are improving. So what does that mean about the CoQ10 you were taking? Was it not helping you in the miraculous way that Dr. Sinatra talked about? No, it wasn't. So is it because of the poor quality of the CoQ10, or you just mainly needed the minerals and the B vitamins? So they're good questions, but this is where we're saying do the research, and do the research on your own body. And don't take supplements just because they sound good and there's good stories behind them. Take them because they work. If you take it and you feel better, keep taking it. So there.
Absolutely. And another great source of CoQ10, natural source, is avocado. And I know people are eating a lot of avocado these days. It is readily available in food. So you've got to balance that, too, against what you've already got, because you may already have enough CoQ10 just in your own little yummy tummy,
Cool.
Okay. Now, Carolyn from Atlanta wants to know, what is the difference between AFib and heart palpitations?
Well, heart palpitations is just an overall general word for your heart jumping around, and AFib is a specific type of heart palpitation coming from the atria that are the top part of the heart, ventricular tachycardia or ventricular, fibrillation. Well, ventricular fibrillation is very serious, but the different areas of the heart can create different types of palpitations. So that's it. And Ginny's busy.
Excuse me. Yep. No, I was sneezing. Okay. Now, Linda wants to know too, Carolyn, about this. I thought the whole thing about grounding was very interesting. Did you not think that?
Oh, yeah, and I do talk about it in my modules. It's one of the 104 modules. So I've learned about it, and mostly from Dr. Sinatra's book. It is awesome, and it makes sense, and people have been talking about getting out in nature and hugging trees and doing all that. But what's happened in the past couple of decades is they've done the research on it, and they find out why and how and all the rest of it. So, yeah, it is awesome stuff. And, yeah, I'll probably upgrade my grounding sheets. It's one of the things that I don't notice. I just live in such an awesome atmosphere here anyway. I feel great. But people can apply it. But, don't get too fanatic. Just make it part of what you do with your world. And actually, that's how I talk about it in my completement or is it Future Health Now? What do I call my series?
It's Complete Now. Yeah.
Yeah, and it's one of the many things that you can do, kind of like a hobby. Don't get too fanatic about it, but try it. Try some of the things that Dr. Sinatra said. I'm going to look at leather shoes, but can I use leather shoes on my 2-hour walks a day? We'll see.
Right. Yeah, that would be awesome. Jack Kruse is a big fanatic about grounding too, Carolyn. You probably already remember that from his writings. But I just thought what was interesting was when he said silver chloride sheets or something like that. I was like, oh, my God. What if the Pico Silver is helping to ground people, and that's what's making these extraordinary results that people are having?
Wow. Yes. Yeah, we'll have to ask our chemist to help us research that. That is amazing.
Yeah, that would be super cool and groovy. All speculative, people, but still, nevertheless, always putting together all the puzzle pieces because, with working in customer service, I see such a big tapestry of what the effects are of people using the products. And, there's people who have extraordinary results with just one product, but when they start getting the synergy of all the products going, it is pretty amazing. And, it's just something else. So having these Pico Silver testimonials just keep rolling in. And people also, report having an elevation in their mood. And I'm thinking, how on the Lord's earth is Pico Silver elevating people's moods? So that made me think about the grounding thing, too, because I know when you do feel grounded and you are present in your experience, you feel a lot more relaxed and happy.
Wow. Yeah. And you hear all these things through customer service. I didn't realize elevation in mood was being reported. That's fantastic, and it's the balance point of getting all those minerals in there. Wonderful.
Yeah, it's really exciting. Well, let's take a few phone calls. Would you like to?
I'd love to. Thank you.
Okay, so 602-666-6027 is the phone number. Again, *5 on your keypad, and we'll put you through to talk to Dr. Dean, and we'll go first to area code 818 in the great state of California. You're on the line with Dr. Dean. If you could give us your name and then state your question or comment.
Yeah, my name is Barry, and we've spoken before. I got your products.
Hi, Barry.
I got your products. Picked up the Realign and the Remag and the Remite, and I started on those some weeks back. And I'm just wondering, when I do a quart, sometimes I'm trying to remember to drink it through the day, but rather than sip it, I found that a kind of a problem for me. So I've usually just every 20 minutes or so, I'll take a couple of gulps of it, and through the end of the day, I'll go through that quart. Is that something okay to do rather than to sip it?
Yes, as long as you're getting results. We started admonishing people to sip it when they said they might get a bit of laxative effect, when we thought they were dosing too much at a time. But if you're getting results, and if you're talking about the 1 quart, but you're also drinking another quart or so with sea salt without the minerals, correct?
Yeah, I'm drinking it around the day. I'll take some other glass. Getting my weight, probably about 75 to 80 ounces a day. I try to do.
Okay, great. Yeah, it sounds good.
And then just this quart I keep in front of me, and I'll just try. I look at it, so I'm trying to, I'm in my 70s, so I'm trying to always, sometimes remember to do it, on time. So.
Yeah.
And one question. Go on. I'm sorry.
No, I was just going to babble on. I'd rather hear your question.
When I have the Realign, and because I have this strange thing that happened years ago, I don't know from where, maybe electromagnetic stuff around me, but I have the resonant blade sensor, and I'll have these little ticks. The ticks are when my one doctor told me that I had a little bit of ADD, and I'm preventing or talking presenting something, I'm fine. When someone starts feeding me information, I'll start getting little tics and little twitches going on. Where he said, well, something in your brain, I think, thinks it has to do something when you're supposed to be listening. So, and when I wake up in the middle of the night or in the mornings, I'll sometimes be kind of, agitated. So I noticed in the Realign it had taurine, and I remember my one neurologist from a few years back had said that could bring activity to my brain. And I'm wondering in the Realign whether that might affect something, taking it twice a day or in the evening, or should I just take it maybe once a day in the morning?
Well, we have not heard people say that it activates them, because taurine does so many things to the body, and I don't think one of them is excitation. But restless legs, tics, and twitches to me are magnesium deficiency.
Okay, I gotcha.
But a sidebar on the brain, I don't know if the blog went out yet. I think it might have, but I've been reading Dr. Norman Doge's work, D-O-I-D-G-E, Dr. Norman Doge, D-O-I-D-G-E, and he's got a couple of books. The Brain's Way of Healing, I think, is the latest. Before that, The Brain That Changes Itself. And I think you would be very interested in knowing how adaptable the brain is, and that it's not going to be being, what did the doctors say, wanting to do something instead of listening. Anyway, I think you would like to understand or overlay your information on the brain and update yourself. It's totally fascinating. And the blog I wrote, I kind of admonish Dr. Doge, because he doesn't even bring magnesium into the picture, whereas magnesium is the one nutrient that makes the brain adaptable and what they call neuroplastic. So anyway, that's your free part for today.
I got you. So stay on it. One of your people when I called in, can I take the Realign? Does it have to be with a meal? Because I do one medication, which is my digoxin. I do it early in the morning. Can you take the Realign on an empty stomach, or does it have to be with something that you?
No, empty or not. It doesn't matter. Anytime people say, well, I feel better when I take with food. Well, go ahead, no problem. I take mine, all of mine. Well, what am I taking? I'm taking Blue Ice Royal, Realign, and food-based vitamin C. That's it. Those are my, and a probiotic. So that's all I take along with my minerals. And I wake up in the morning and I do put my teaspoon or half a teaspoon of Remag, a teaspoon of Pico Silver in a glass of about 8 ounces. And I kind of gulp that. I have to admit, I do gulp it. Because I've gotten past the stage where I need to sip it, because I was taking 4 teaspoons in the beginning, and now I'm taking half a teaspoon. Yeah, I'm taking half a teaspoon twice a day, and that keeps me away from heart palpitations and leg cramps, and I can actually skip a couple doses before feeling that my cells are no longer saturated. So that's a testament to your body just holding on to what it requires, and then it'll dump the excess of magnesium that it doesn't need. I think it's just awesome the way magnesium works in the body like that.
Can I also, which I've been doing a long time, and the last question, I do a green drink. I mean, as a powdered green drink from Garden of Life, maybe a teaspoon of that, a little cap of that daily. And I still have been doing my liquid vitamin from Country Life. It tastes so good, and I just take a little shot of that in the mornings with a meal. Would that still be something I can still do? It's still, or included along with everything I'm doing? Okay, so
I mean, the way you're talking about a teaspoon, it's like they're like your friends, and you don't want to stop them.
Well, it's not a teaspoon.
Right?
You take a cap of the liquid vitamin. It's probably an ounce, maybe something like that. And when you,
a big one.
Well, it's just a cap. It's a cap that goes on the bottle. And then when you do my green thing, it's like they have a little scoop in there. You take one little scoop, which is probably a tablespoon. Probably a tablespoon. You put in not soy milk. I use the silk almond milk because it's got 10 grams of protein in it, which is great by silk. And I'll put it in there in the green drink. It's kind of got a little bit of the cacao in it, which is nice. And so, yeah, I'm trying to spread that through the day. I just didn't want to OD on taking other supplementations. That's why I was asking you that, along with the magnesium. But
well, I'd have to look at the ingredients, and you can do the same. You can look and see, are you duplicating? Is the liquid vitamin more synthetic than not? Are the Bs synthetic, or are they methylated and food-based? When I wrote the blog, Dr. Dean's Supplement Recommendations, I kind of go over that step by step, and yes, it doesn't sound like you're overloading, but you could check that out. I'm more concerned about people who have a dozen different supplements, and a lot of them are antioxidants. And the bandwagon I've been on recently is, well, the body oxidizes a lot of things in its biochemistry and its physiology. It has to oxidize. So are we taking so many antioxidants we're stopping some natural processes, thinking that we're being so smart taking all these things? And that's where I tell people, just take what you need and what makes you feel good.
Well, because I have, AFib. I'm in AFib all the time, so my cardiologist is also alternative, has me on some simple things like natosarazyme, which is kind of a natural, kind of a blood thinner type thing rather than taking a blood thinner. And, ginkgo biloba and maybe a DHEA and just a couple of basic things, So when you add them all up,
so there's stuff going on there, but you're still in AFib. How much Remag are you taking? And I know that was our last conversation. Well, you should be on more Remag and make sure you're on Remag and line.
Yeah, I started. I'm on 3/4 of a teaspoon now because I waited 4 or 5 days on each one. 3/4 of a teaspoon on the Remag, 3/4 of a teaspoon on the Remag, and then I'm now going to maybe start tomorrow with another quarter, which will make it 1 teaspoon of each, and a quart of water. Right. And then you'd like me to continue to build up from there, continue right up to 2 teaspoons,
Correct.
Or stay? Okay.
Well, I mean. It depends on your symptoms. If you're starting to feel that it's helping somewhat, then maybe your AFib is a magnesium deficiency, so you keep going until you're saturated. And I've already mentioned that I had to go up to 4 teaspoons, and I'm only like 107 pounds, so I don't know what your weight is, but
I'm about 150. I'm pretty light, yeah.
Right.
155,
so you have to,
maybe something like that.
Right. But you see my rationale. It's like if you intellectually, in reading and understanding about magnesium deficiency, and your restless legs, that's magnesium deficiency, tics and twitches, that's magnesium deficiency. If you can convince yourself that, maybe I have a magnesium deficiency that's causing my heart to jump around, maybe I should take more until I prove to myself whether or not I can saturate and see how far I can go, because it sounds like your cardiologist is a good person who's supporting you in doing this naturally, so you're very fortunate.
The one last thing you mentioned me last year on the digoxin, maybe if I noticed at some point, I only take it because I had a little faster heartbeat, and now with the digoxin it's probably about 70 beats a minute. So when would I maybe listening, I would recognize if it looks like it's getting slower, then I should maybe slowly talk to her about pulling off of the digoxin. You had mentioned that to me last year.
Yeah, that's exactly.
I should be a little more cognizant of that.
Correct. If the meds that a person is on, if they seem to be working too well, then it means your body is strengthening and you might not need the meds. And then, just like Dr. Sinatra said, work with your doctor to wean off it.
Gotcha. All right, I'm going to let some other people ask questions. I can always call you back next Monday.
Oh, yeah. And you ask good questions, and that's why I give long answers, Barry, because a lot of people are thinking these questions. And I love hearing your voice. You've got such a great voice. Thank you for calling.
That's 40 years. That's 50 years of being a singer, so anyway.
Oh, awesome. Okay, appreciate you calling.
All right, guys. Thank you so much. Thanks a lot.
You're welcome. Bye-bye.
Bye.
Okay, excellent. Let's take a couple more phone calls, and let me just, we'll get our phone calls in, and then we've got some questions on the chat line, but I don't want to keep our callers holding for very much longer. So let's go to Albuquerque, New Mexico, area code 505. 505, you're on the line with Dr. Carolyn Dean. If you could give us your name and then state your question or comment.
Hi, this is Graham.
Hi, Graham.
How you doing? I'm calling about, can you describe the absorption patterns of like Remag? And more specifically, I'm thinking of using it on the knee. Because I know the knee, you have the skin over the knee, but then the knee structure has a lining over it. Does the magnesium penetrate that lining?
Well, Graham, that's where you'd use the oral Remag as well as the Remag lotion so that you would get it coming at you both ways. And I don't know if I have an answer. I mean, we certainly have not done the study where we put Remag lotion on the knee and find out where it ends up. I don't know if that study will ever be done. But you can do that study on yourself. You can be the N equals 1, where N is the number of people in a study, correct? So you do the study and let us know, okay?
Well, yeah, I do the oral magnesium as well, and
right.
I spoke to you earlier about this, and I know we're not supposed to talk about dissing anybody's ease on the show, but I have this I have this condition that is below the lining of the knee where these nodules form.
Oh, right.
So I'm attempting to, because I keep trying to find anybody that knows anything about it, and the only thing modern medicine suggests is, well, they want to slice open your knee, and maybe or maybe not it will work,
Right. Yeah, tell me a little bit more about this. How do they know you have nodules, and what are they doing to you?
Well, I had an MRI, and it was diagnosed as pigmented villonodular synovitis. And that's where these tumors form underneath the knee. And they're not cancerous tumors, and they don't spread. But this is it's kind of like really sort of rocked my world because I can't be active. I can only walk about 4 blocks at the most.
Yeah.
I can't really do my full set of Tai Chi that I've been doing for 35 years.
Wow. So with the on the MRI, did they pick up any calcification?
Don't think so. I can.
Check that out, because if there's any calcification at all, then the magnesium definitely can help, because it makes calcium soluble. And pigmented villonodular synovitis.
I can read you what the MRI says. It says the MRI findings of your right knee indicate large joint effusion with extensive synovitis, some of which has internal low signal suggestive of pigmented villonodular synovitis. Recommended orthopedic consult. Less likely considerations infection and crystalline arthropathy.
Okay, so there's crystalline. If they're mentioning that can be some usually calcification, calcium deposits. But I don't know if you've heard me talk about the Pico Silver helping people's joints, and the reason why.
I've got some of that too.
All right, yeah, that I would focus on that, because when you get that type of effusion and synovitis, it can be some sort of subclinical infection. And like I always say, the Chinese say that in order to protect our internal organs, any types of infections can be redirected toward the joints. And the way people are these days with yeast overgrowth and viruses, etc., then we all have some subclinical infections. I have cold sores that I got when I was a kid, and every once in a while one will pop up. So I know that I have this chronic virus, and I'm just hoping that with the Pico Silver that they just won't pop up anymore. So I would focus on the Remag, the liquid and lotion, and I would be taking the Pico Silver.
Can the Pico Silver be used topically, like on the skin?
Yes, yeah, it can. I don't know if we're going to get into all the various ways that you can apply. You know, they have gels and creams and everything, but it can definitely be absorbed very well through the skin.
Yeah, I've tried it. It absorbs pretty quickly, much quicker than the liquid magnesium. Well, anyway, I appreciate it, and
Graham, you have to. Yeah, you keep us posted. We want to know what's going on with you there. If we can cut down this inflammation and get rid of any crystalline stuff or any infection. So, you know, there's a lot of things here that could improve. So we want to know about it. Okay.
Right, and tell Ginny to take care with Hurricane Florence coming.
Oh, she'll be fine. She'll be fine. The sky may fall, but it's not going to fall on us. That's what we always say.
All right. Have a good evening.
Thanks, Graham.
Bye.
Yeah, you too. Bye-bye.
Okay, excellent. And let's go out to California area code 925. 925, you're on the line with Dr. Carolyn Dean. If you could give us your name and then state your question or comment.
Can you hear me?
Yes, and we can hear you now. Go ahead.
Oh, great. This is Rebecca, and I was interested, since you were talking to the doctor about grounding, just in our area within the last month, everyone is getting those smart meters, and I have noticed when I had no problem with sleeping, my sleep was doing really well. Now I feel quite agitated at night, and since you mentioned the silver, and I don't have that yet, I was wondering if more research on that will be done, and if maybe that could help with the new sleep issues from the smart meter.
Right. Yeah, I haven't really looked into the smart meters a lot, but I know with any sort of EMF, they do say that these electromagnetic influences do something to the calcium gates, GATES, in the body. And when I saw that research, I did put it in the Magnesium Miracle book. I thought, oh my gosh, so that means that magnesium is going to help people with EMFs, and it does seem to. So the Remag for sure, possibly and probably the Pico Silver, in that the grounding sheets are silver. Externally, I mean, yes. So you'll do the N=1 experiment on that, Rebecca. I don't know what else to say. You know, it's like, do you wrap these things in aluminum foil like the the joke about people trying to avoid electromagnetic influences. They make little hats out of aluminum. I mean, what are we going to do about these things? I really don't have a concrete answer, but maybe I would add that the RNA drops are helping people, we believe, and we've been told, helping people with radiation and pollution and the excess carbon monoxide with pollution, including all the carbon from the wildfires. So we think that our whole package of formulas is very helpful for all that exists in our world, and we do say the sky may fall, but it's not going to fall on us because we feel very protected.
Nice. Well, I appreciate that, and I think I'm going to add the RNA drops and the silver to my repertoire here.
Oh, wonderful. And don't let your mind worry about these smart meters. Just say, my body protects me. Actually, maybe I should just mention that we do have in the Total Biology, we have that affirmation, and I'm just dialing it up right now, where we say, I was a small property ravaged by a storm, ravaged by a smart meter. The fine weather has returned. The forest and the river have become calm. The house is vibrant and shines in the sun. And above all, the field is returning to its order, health and beauty. Thank you, my diseased and or depleted organs, for I know you have done all this to save my whole being. And thanks to myself for doing my healing. So that can get people beyond all the the negative that we hear in our environment. It seems like the media news has to be negative, even more and more negative, to claim our attention, and we cannot allow ourselves to succumb to that. We just have to stay grounded and firm in our belief of our own strength and divinity. And Ginny will tell you where that affirmation is.
Thank you.
Yeah, it's on our Dr. Carolyn. It's on our drcarolyndeanlive.com website. All of our affirmations are there, and if you type in affirmation, it'll pop up for you in one of the blog posts. Or you can email support, SUPPORT, at rnareset.com, and just ask for the small property affirmation, and Melody Rose or whoever's working the emails will send it to you.
Perfect. Thank you so much. I appreciate you guys.
Oh, you're so
thanks,
welcome.
Rebecca. Thanks for calling in.
Bye-bye.
Bye-bye.
Thank you. Bye.
Okay, Carolyn, let's blast through some of these questions that we have here. Linda's typing in and asking, are there ways to get off diuretics when you are recovering from low ejection fraction caused by much stress and AFib? I don't know how, and the doctor doesn't seem to think it is as important as I do, of course. I continue to take my 3 teaspoons of magnesium daily anyway, even though I know they are washing all my minerals and magnesium away. Help, help, help.
Well, yeah. I mean, if the doctor doesn't think you should get off diuretics, that's kind of bizarre unless you still have a lot of fluids on. People retain fluids in the wrong places when they don't have enough minerals, and that does include the sea salted water, the REMAG, and the REMITE, because it's all those minerals that are absorbed so well into the cells that will pull fluids into the cells behind them and get the work of the body done. So if you don't have fluid retention, so I don't have the full story here, if your fluid is better, then you should be weaned off diuretics. Maybe you need another doctor to help you with that matter, because as you say, if the diuretics are pushing too much fluids out, yes, it'll drain your minerals, and that's well known. So I guess I would just look for another doctor.
Very good. Excellent. Good advice there. Okay. Susan, I've been on 1.5 teaspoons of Remag, 3/4 teaspoons of Remite in a liter of water, and I sip it through the day for 5 weeks now. When I wake up in the morning, I still have fast heart palpitations, which is my goal to overcome. Should I increase the dosage of Remag and Remite daily?
Yes, I personally would. I can't tell you to, but you've heard me say several times, even just today, that I had to go up to 4 teaspoons before I fully overcame all my symptoms. So, yes, and if you read our AFib book, not that you have AFib, but it gives you an insight into what to do for heart situations. And we don't say people have heart disease necessarily. They have magnesium deficiency until proven otherwise. So 1.5, what's that, 450 milligrams of elemental magnesium. So that's only the RDA. It's just enough to keep things going at a balanced pace for someone who has no symptoms. So if you have symptoms, then it sounds like more would be helpful.
Very good. Excellent. Okay, now Linda typed back in and said, I do seem to get unwanted fluids collecting if I am not on the diuretic. So apparently when she goes off, you know.
Mm-hmm. Jenny sneezing again.
No, I'm not sneezing. I'm saying that was her response. So she basically she says if she's not taking them, she does have the unwanted fluids collect. But you know, I don't know, Carolyn. I mean, when you do things on edema, you always talk about the sea salted water. So I guess the sea salted water, the Remite and the Remag, like you said. Linda, type in and let us know if you're doing all of those together the way
Correct.
that Carolyn recommends. Yeah. And if not, then that's probably the next place to look. Okay, Marissa types in and says, I'm a healthy 52-year-old woman. I've been using all the products for 1.5 years, and I'm starting to get hot flashes. I've been lowering my dose down to from 2 teaspoons of Remag to 1 teaspoon, from 1 teaspoon of Remite to a 1/2 teaspoon, the Recalcia to Realign, and I love my Remag lotion. Should I keep doing what I'm doing or change something? It sounds like she already changed something, though, Marissa. That was confusing.
Yeah. Okay, what do you mean? Marissa, phone in. We still have time. Phone in. Let's get this sorted out. You're 52. It sounds like you're going through menopause, so why would you cut back on your minerals that are supposed to support your hormones? This is not the time to cut back. So that would be my off-the-top answer.
Okay, very good. 602-666-6027, Marissa. Hop on the phone real quick and hit star 5 on the keypad, and then I'll put you on the phone with Carolyn, and like she said, we'll get it all sorted out for you ASAP. Okay, Carolyn in Atlanta is typing back and saying, she's the one who typed in earlier and asked the difference between AFib and heart palpitation. She said, so should I go see a cardiologist to see what I have? Usually it's very quick and I grunt and it's over, but sometimes I get a little lightheaded when it happens and then I catch my breath. It usually goes away right away. I gave up caffeine and it stopped, but occasionally I do drink tea that has caffeine in it.
Right. Well, it would be good to get quote diagnosis, because you should know how careful you should be according to what they find on your EKG and maybe your ultrasound. When I did mine, I just had sort of ventricular premature beats, I think it was, and they said, my cardiologist friend said it wasn't a big deal, but it was a big deal to me to have it, but it wasn't AFib. So it would be good to know, and sometimes that really motivates people to be very careful. You can read the AFib book to see what else might be happening that would cause this agitation of your heart. And we think it's a stimulation. If you think it's a stimulation from the caffeine, then that could mean your electrolytes are a little off, and that implicates magnesium as deficiency. So yeah, you always want to get uninvasive testing to see where things are at, but you try to plug your ears when they tell you that you need a whole bunch of drugs, in case, as Dr. Sinatra was saying, in case it is full-blown AFib, which it does not sound like it is, and I'm needing blood thinners that start with grounding and then aspirin and then the nattokinase before you get to the real strong guys. So that covers
very
that.
Good. Let's check this new call from Cornwall, Ontario, Canada, and see if this is Marissa. Marissa, is this you?
No, it is Glenn.
Oh,
hi, Glenn.
Hello. Okay. Hi. How are you?
Go ahead, Glenn. We've got 4 or 5 minutes for you.
I'm going to go quick. I'm a chronic pain therapist here in the Ottawa area, and I have a client who had a hip replacement, right hip replacement done a number of years ago, probably 5 years ago. He has developed idiopathic pain in the nervous system that's affecting the lumbar spine. Nothing shows up positive. There's no imaging issues. He's had 3 MRIs. All blood work is good. They've tested the blood for cobalt, I think it is, that can enter the bloodstream from a prosthetic hip or knee. Everything is within order. What I'm wondering is, can the Pico Silver, well, let me backtrack one bit. Is there any metals interfering with the metabolism in the body coming off that hip that maybe they can't see in the common blood work that they're doing?
I don't know about that. I mean, I don't know all the metals involved in hip replacements, but what I've said before to this question is they've done, I think they do 300,000 hip replacements a year in the U.S., so that would be 30,000 in Canada. And I don't see this type of chronic pain coming up. What I would say that relates to what I was mentioning earlier, look at Dr. Norman Doge's books. He's in Toronto, and let me get the names of the books again. He talks about neuroplasticity, so he's written, the brain's wave healing and the brain can change or whatever. Now, what he says in terms of pain, and you already probably know this, is some people can have a pain site that in the math of the brain, that the pain site can increase because there's not enough input, non-pain input into the area. So the brain pain area expands for no good, well, they know now why, but it's like for no good reason the pain is expanding in some people. And you can relearn how to undo that pain. Now with hips, I don't know what it means. Sometimes they say bind up the non-painful side and make the person use that side to put normal movement input into the brain so that the brain stops thinking of it as a pain site. And that's just, I haven't grasped the whole theory enough to be able to explain it properly, but do you know what I'm getting at, Glenn, from your pain therapy work?
Yes.
Okay, tell us.
Yes. What is it you were asking again?
Does that make, is that part of what you know as a pain therapist? And do you have some way of either getting in touch with Doge, or are there clinics that can help you and to help this person with the right exercises to help overcome this expansion of pain?
Well, what I'm surmising has happened with him, he's developed a neuropathy that is really, really devastating to him. And I was curious about the pico silver, if you want to call it that, and the magnesium for the neuroplasticity.
Right. Absolutely.
But the pico silver would not. Does the pico silver enter the bloodstream?
Sure. Yeah, it will enter the blood, go into the cells, go to sites of inflammation or subclinical infection. So it can be that's happening, inflammation, subclinical infection at the site, and then giving referred pain over to the lumbar spine. So you can go at it always. And the Remag, of course, local Remag lotion and oral as well for inflammation. I'd like, I need to know more about what Doge's work is and if that would be helpful. But I would start with the physical for sure, the physical nutrients.
And I am familiar with Dr. Deutsch and another top. Yeah, okay. We're running out of time.
We're coming to the top of the hour. I'm so sorry, but thank you, Glenn, for calling in. And thank you, everybody. What a great return to the radio show, Carolyn. I hope you had a wonderful evening. It was a tremendous program.
Yeah, it was awesome. Glad to be back. Thank you, everybody, for listening and calling and chatting. Thank you, Ginny. Thank you, Bob. Thank you, Bill.
Thank you, Bob.
And thank you, Ginny. Thank you, Ginny. /AchievRadio.
Well, each human has that non-physical part, the source energy part, and that's the part that resonates with everyone else, you see. Yes. And yet you're individual. You have your own embodied individuality. You are the creator of your universe. Your mother erroneously told you that the world doesn't revolve around you, when indeed it absolutely does.
Very, very wonderful.
We're back.
Psychic radio, holistic radio, spiritual radio.